HIV/AIDS, TB, and malaria. And I say this because of the commitment of the President of the United and the people of the United States of America towards funding and other forms of technical assistance to support an effective and sustainable strategy and response to combat the HIV/AIDS epidemic in the Caribbean and other regions worldwide. And so, on behalf of people in the Caribbean and millions of young people across the world, I must say thanks to PEPFAR and the American people for that. In the last 3 years, advocates, including youth activists from the International Youth Speak Out project and Advocates for Youth, have traveled from Ethiopia, Jamaica, and Nigeria to advocate and join other young people and other advocates all across the world to lobby policymakers in Capitol Hill about the PEPFAR program and to end the funding for abstinence and Be Faithful Only campaign. We have joined our colleagues as advocates for you because we strongly believe that the global epidemic requires a comprehensive, multi-sectorial response that expands access to prevention, care, treatment, if we want no child to be born, if we want children to be born HIV-free, and if we want to reverse the number of new infections each year. Among several targets and indicators, the Goal 6 of the Millennium Development Goals, signed in the year 2000, outlined an ambitious but achievable objective to halt and begin to reverse the spread of HIV/AIDS in the world. This is important to us as young people because young people are continually marginalized in the fight against HIV/AIDS, particularly because policies and programs continue to be about what policymakers think they should be, and not representing the epidemiology and the needs of us as young people. UN highlights that many young people still lack the knowledge to protect themselves against HIV because political prejudices continue to undermine implementation of an effective HIV strategy. Combined with other factors, the rate of reinfection continues to outstrip the expansion of treatment. Why is it so? Why are so many young people being denied from receiving information about comprehensive sex education? Policies are still unresponsive. They do not always cater to our needs and priorities as young people. They are not applicable to our current circumstances and the media that we are bombarded with daily. We need abstinence, we need Be Faithful, and we also need condoms if we're effectively combat HIV/AIDS. We also, as young people, need comprehensive sex education to tell us about sexuality, how to use condoms effectively, and how to prevent the spread of HIV among us as young people and other adults that we may or may not have sex with. As a young person growing up in Jamaica, not so long ago, I remember I was never privy to information about comprehensive sex education. If you asked me what that was, I could never give you an answer. I knew there was something called sex because, of course, that is how I came here on this world, but I knew nothing about how to protect myself or how I could tell my colleagues how to protect themselves from the HIV/AIDS epidemic. The little I knew about HIV was from posters that drove fear into us as young people, showing penis and vaginas with all sorts of sores. And so, as young people, that was my fear as a young person that, wow, this may happen to me, and so I could never, become involved in any sort of sexual activity. However, not many young people were driven by this fear, and so a number of young people continue to become involved in these things. Sexual initiation in Jamaica between ages 10 and 24 is quite high. Especially among girls, starting at about age 9 in some cases, and 13 among boys as well. In 2001, a survey showed that more than 1,000 adolescents, among more than 1,000 adolescents, 73.7% of 15 to 19-year-olds and 9.5% of 10 to 14-year-olds reported being sexually active. So why is it that in Jamaica, young people cannot get access to condoms? Why is it that stigma and discrimination continue to drive young people away from effective and sustainable approaches to combat the HIV/AIDS epidemic in Jamaica? If we are to truly combat HIV/AIDS, and this is particularly important because PEPFAR has recently announced on June 22 of this year that they have given Jamaica about $25 million to fight the global AIDS epidemic in Jamaica and the Caribbean. And so, starting this August, PEPFAR should ensure, I think, that Jamaica use a sustainable strategy, an effective approach to combat HIV/AIDS among young people by ensuring that stigma, discrimination, and access for young people towards condom and contraceptives are not prohibited. That young people in schools get comprehensive sex education, because in Jamaica we have the Health and Family Life Education Policy, which is supposed to be in all schools, but has still not been rolled out in all schools, and so young people are continually marginalized because of, we're not getting that sort of information that we need. And so it is important because there are still gaps and nuances in the policies that the government use. The HFLE policy, as it is called for short, does not recognize really, alternative sort of sexual behaviors among young people, particularly men who have sex with men, or lesbians, or even transgender, if they may exist in primary or high school. And so, if PEPFAR is going to, as they say, in collaboration with the Ministry of Health in Jamaica, to ensure that an effective policy for the next 5 years goes in Jamaica, then these sort of things must be tackled, they must be included, and they must take priority, because we cannot continue to have an effective strategy if it continues around the ideas of heterosexism and heterosexuality. If we want to if we want to have an effective strategy in Jamaica. Young men particularly have serious concerns with HIV/AIDS. If you look at men who have sex with men, it's about 25 to 30% in that population. And then a study done by the Ministry of Health also showed that young people are particularly marginalized, because there was about 80% in a study done in 2007, and showed that those men who have sex with men are doing these things because they want to access money for transactional sex and all sorts of things. And so, as a young person personally, and having grown up with so many young people, I know so many young people who have been marginalized, who have been alienated from services and access to prevention, treatment, and care. It is important that PEPFAR ensures that abstinence only and be faithful only campaign ends, because young people are having sex. And as James Wagner advocates always say to us when we do any sort of advocacy, when we take an umbrella with us as young people, the rain doesn't automatically fall. So why is it that older persons or policymakers believe that if we give young people access to condoms, or if we tell them about comprehensive sex education, then it will automatically mean that we go out and have sex? Why is it that adults, if you give an adult a condom, they wait and they may not have sex for a year, they choose not if they don't have a partner? Because they have information, they feel that they're responsible, they feel that they know what risk they're taking. And so young people need these life skills and this information that we can access, and we can prevent sexual initiation, we can prevent HIV, we can prevent early pregnancy.